Do you have a stye that you're trying to get rid of? Have you tried warm compresses and the stye still hasn't gone away? In this video, I'm going to share my ultimate guide to getting rid of that stye coming up. Hey everyone, it's me, Dr. Smith, and let's get into my ultimate guide to treating a stye. And watch until the very end where I'll give my best tips to keep those styes from coming back. So to conquer your enemy in battle, we have to understand our enemy and what it's made up of. A stye is simply an infected oil gland in our eyelid. Our eyelids have about 25 oil glands in the upper eyelid and about 20 in the lower lid. The reason we have oil glands in our eyelids is because the tear is made up of 3 layers. We have a mucus layer on the bottom, a water layer in the middle, and a little thin fatty layer on the top that acts like a barrier and shields the water part of the tear from the atmosphere. It does so to prevent our tears from instantly evaporating off the surface of the eye. That's why we can have staring contests with each other. It's that top layer of oil, or meibum, that slows down the rate at which our tears evaporate from the surface of our eye. And when one of these oil glands gets infected and can't drain or express the pus from the gland starts to swell, turn red, and can be quite unsightly. It's very painful to the touch. If you have a bump on your eyelid that's been there for a long time and is not red and painful to the touch, we call that a chalazion. By the way, never try and pop a stye because it can push the infection deeper into the oil gland and increase the chance of that stye sticking around even longer and eventually becoming a chalazion that can end up staying in the eyelids for weeks, months, maybe even years, and might even require surgery to remove it. So never try to pop a stye. So if you think you have a stye, the first thing you should do is see if that red painful bump hurts when you push on it. You should also see if the swelling is in a very localized particular part of the upper or lower eyelid. If the swelling involves the entire eyelid, maybe both eyelids and even parts of the face around the eye start to swell up, then it could be something more serious than a stye, like a preseptal cellulitis, and might require an oral antibiotic to make it go away faster. If the swelling is in a localized part of the eyelid and is very painful to the touch and maybe even comes to a whitehead, then there's a pretty good chance that it's a stye, and that some of the treatment methods we're about to go over will be successful in curing that stye. And the disclaimer here is that the information we're about to go over is not intended to replace a visit to your optometrist, who can more properly assess your eyes and diagnose your painful bump as a stye or something else, and professionally recommend the best treatment plan. The treatments discussed here also do not create a doctor-patient relationship. The idea here is to share some useful information that could help you in some form or another. That being said, here's what I would do if I had a stye. Start to hydrate. I did a video about why it's so important to stay hydrated. Our bodies are mostly made up of water, and in fact, we can't even survive long without proper hydration. I would immediately begin warm compresses about 2 or 3 times per day, even though this might not be the ultimate reason that it resolves. The heat essentially brings the immune system to the eyelids and also warms the oil in the meibomian glands and softens it. This allows the oil to flow out more easily out of the gland that's holding the infection in, creating an environment where there's a better chance that the stye will drain and heal. There's actually a video that talks about how I give my patients a stye kit that has the supplies to do a special nighttime treatment. The contents of the stye kit can be purchased individually online, and I'll include links to these products below and a link to the video I made that discusses in more detail how to use it. Essentially, the way it works with the stye kit is before you go to bed, you'll do your last warm compress of the day. Then you soak your eyelid for about 10 minutes to soften the skin, kind of like when you stay in the shower too long and the skin kind of wrinkles up on your fingertips. After the eyelid is soaked, you place a breathable eye patch over your eye, peel the inside corner up, and add a few more drops of preservative-free saline under the patch to keep the eye moist. And leave that breathable patch on overnight. Hopefully with the softened oil from the warm compress, the softened tissue from soaking, and the gentle pressure from the patch, that stye will express while you're sleeping. Sometimes you have to patch for a few nights to have this work, and it doesn't always work for everyone, but for some people it works literally overnight. Remember, this is a nighttime treatment. If the stye drains and there's a lot of pus draining out, you'll most likely need an antibiotic drop prescribed from your optometrist to prevent a full-on conjunctivitis. So keep your eye doctor in the loop. If you're real serious about getting rid of that stye fast, you could have your eye care provider treat your stye with intense pulsed light, or IPL, that in many cases can speed up the recovery time and make that stye go away even faster. The best thing to do would be to ask your optometry office if they have the capability of doing ocular IPL treatments before taking the trip in to have it done. Usually this is something not offered at optical chain settings, but more at medically focused eye clinics like a private practice or even a private practice inside an optical chain. Your eye doctor might consider lancing the stye in office. This is usually done if the stye is found to be at the right stage to have success if the attempt to lance the eye takes place. Take a second and smash the like button if you're liking the content. I promise to tell you about some ways to prevent styes from forming in the first place. Here's what I would do. Do your best to stay hydrated by carrying a water bottle that's easy to take with you and easy to use. I'll include a link for my favorite water bottle in the description below. For example, the bottle I use has a button that I can use to flip the lid open with one hand, and it's easy to close again with one hand so I can sip while I'm driving without having to screw the lid off and use both hands. Get on a premium grade marine-based omega-3 supplement and shoot for 1,000 milligrams per day. If there's one thing that we can add to our diet that moves the needle faster in reducing dry eyes and improving the quality of the oil in the meibomian glands and the eyelids, it's a good marine-based omega-3 in the form of fish oil. I'll include a link for my favorite brand in the description below. In this channel, I focus on the best tips and products to keep your eyes looking good and feeling great. So if you're new here, consider subscribing and hitting that bell to be notified when new videos come out so you don't miss any. Question of the day: if you've had a stye in the past, what have you done that's worked best to make that stye go away? Let us all know in the comments below, and feel free to tag me if you have any questions using my handle that's found in the description. At the end of the video, I'm going to include not only links to the products that I discuss, but also links to some other good stye related videos, even by other eye care providers that are filming videos on YouTube that I've found that have given the best advice on making your styes go away fast. I'll include a link to those videos in the description below, and I'll see you in the next video.